Hello everyone, my name is Adrian Tapia and I'm going to talk about an 18-year-old man with hematuria and retroperitoneal mass. Presentation of case. An 18-year-old man was seen in the urology outpatient clinic of the hospital because of a retroperitoneal mass and a history of transient hematuria. The patient had been in excellent health until approximately 1 month before this evaluation, when after hiking he noted a small degree of hematuria without pain for 2 days. On evaluation at a hospital near the patient's home in South America, transabdominal and scrotal Doppler ultrasonography revealed a heterogeneous, well-circumscribed mass anterior to the right common iliac artery that had prominent journal vascularity.
Hematuria means passing blood in the urine. Now there are two types. One is microscopic hematuria. That means the person will not be able to see blood in the urine. But if he does any urine routine examination, then he will be able to see RBCs in the urine. And a microscopic hematuria where a patient will see that he is passing blood in the urine. Now there are various causes according to the age group. In younger age group it can be because of the infection. Like they will have associated urinary symptoms like burning, dysuria, like pain while passing urine. Rarely in younger children, sometimes they have bladder cancer, which is a rhabdomyoid type of cancer, where you can have bleeding in the urine. The middle age group, the bleeding can be because of infection, because of stones in the kidney or the bladder, or because of the cancer or the kidney, ureter or bladder. And in elderly patient, it can be because of the prostatic obstruction or any of the cancers like prostate cancer, bladder cancer, ureteric cancer or kidney cancer. Depending on the cause, like if the patient has only urinary tract infection, we can give them antibiotics. Initial course of 7 days followed by maybe 3 weeks or 4 weeks low dose antibiotics should take care of their urinary infection problem. Those patients who have stone, the stone should be treated. Those patients who have cancer, then it should be treated accordingly depending on the stage of the disease.
Well, family and personal background of the patient. He had excessive bleeding after a tonsillectomy and an endoidectomy in his jaw, but had no subsequent bleeding during dental procedures or while he was brushing his teeth. He was otherwise in excellent health. He was physically active with activities including running, playing soccer. He took no medications and had no known allergies. He lived in an urban area in South America and was student. His mother had multiple sclerosis. Brother had insulin-dependent diabetes mellitus. His paternal grandfather had died of heart disease, and his father and other siblings and grandparents were healthy. He did not smoke tobacco, drink alcohol, or use illicit drugs, and he was not sexually active. On the examination, the abdomen was soft, the mass was barely palpable. There was no regional lymphadenopathy, pain, or discomfort. The remainder of the examination, including a genital examination, was normal.
Welcome to this educational program. This module provides general information about hematuria, or blood in the urine. This presentation is written by specialists in this field and is independently produced. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Hematuria is a clinical term meaning blood in the urine. Hematuria may be a sign that there is something abnormal in the kidney or anywhere along the urinary tract from the start of the kidney drainage system to the end of the urine channel or urethra. The presence of any blood in the urine should always be taken seriously and investigated quickly. The urinary system begins at the kidneys, which are fist-sized organs located in the flanks. These are vital structures with many important roles, including filtering waste products out of the blood,
differential diagnosis. We can make a differential diagnosis with non-neoplastic causes of hematuria. Hematuria could be caused by spontaneous retroperitoneal hematoma. Also, infectious causes must be considered, particularly at this location where the mass could have arisen in the gastrointestinal tract. Retroperitoneal tumors. If the mass is a neoplasm, the four leading groups of diagnostic possibilities include mesenchymal soft tissue sarcoma, tumors of neurogenic origin, germ cell tumors, and lymphoproliferative disorders. Oh, this is not working anymore. A summary of the case: in view of the location of the mass, the patient's clinical history, and the fact that the mass is localized and well circumscribed with no surrounding lymphoadenopathy, our primary consideration was soft tissue sarcoma. Since the lesion has no evidence of fat content, leiomyosarcoma or malignant fibrous histiocytoma would be high on the differential diagnosis. Surgical resection is considerably recommended.
So sarcomas are cancers of our supporting structure, or what we call mesenchymal tissues. And these things can arise from things like soft tissue, muscle cells, nerves, bones, fatty cells. And there's about 50 different types of sarcomas. They affect all age spectrums, including kids and adults, and can happen all over our body, including our arms and legs, but also what I treat, which is in our abdominal cavity and in our retroperitoneum or in our back. So there's about 13 to 15,000 cases of sarcoma in the United States every year. However, the key thing to remember about sarcoma is that they affect all the ages. So kids can get sarcomas and adults. And because of that, you have to have a high index of suspicion to look for them and have appropriate treatment for them. So most sarcomas don't have major signs. That's the reason that they often become very large before they press on surrounding structures and then give you typical signs and symptoms. And for those which I treat, which is in the abdominal cavity or in our back, what's called the retroperitoneum, the signs can be vague signs such as back pain. Sometimes it's pain going down your leg or nerve pain. And in the extremities or in your arms and legs, if there's tumors, if you see a mass that is there, that wasn't there before, and it's growing, that can also be something to look out for a sarcoma. So there are 50 different types of sarcoma, and depending on the type, treatment options can vary. But the foundation of treatment of sarcomas is surgical resection. Alongside, there are various other choices. There's radiation therapy, chemotherapy, and more what we term biologic therapies, or therapies based on the underlying genetic changes. Radiation therapy is a big component along with surgical resections, and radiation is often given before surgery. And oftentimes at Hopkins, we give intraoperative radiation therapy at the time of removal of the tumor to optimize our treatment of sarcomas. So because of the rarity of sarcomas, it is important we go to centers that do have experience with sarcomas. And you can imagine that with 50 different types, most practitioners don't see more than a handful of sarcomas per year. Therefore, it's important that we go to teams that do deal with sarcomas all the time. And part of the treatment of sarcoma is defining a treatment plan prior to surgical treatment. These sarcomas, as I mentioned, are often large, and we often have multiple surgeons who were needed at the time of surgery. Alongside what we know about sarcoma is the biggest determinant of long survival is the extent of surgery. That is, how well is the surgery done, and are we getting what is termed as negative margins. Therefore, going to the right center who can define the proper treatment plans and also do that right surgery is key in ensuring that we have good outcomes from sarcomas.
The pathological discussion. The patient is supposed to have Castleman's disease, which is also known as angiofollicular lymph node hyperplasia or giant lymph node hyperplasia. It's a heterogeneous group of disorders that is associated with distinct pathophysiological features and a distinct prognosis. And all the disorders share some histologic features.
One of my disease of focus has been Castleman's disease. It's a rare disease that's occurrence is quite infrequent both in America and outside America. And it is a disease that involves lymphoid organ. It could be classified as lymphoproliferative disease. It's not a malignancy, but it presents mainly with a lot of symptoms. Patients come with fatigue, night sweats, fever, body ache, sleepiness, and there are all varieties of levels of severity of these symptoms. Some people are almost bedridden because they feel really tired, don't feel like getting out of the bed. Others have milder symptoms. They go about doing their normal work in life, but well, in the afternoon I need to sleep. That's what their complaint could be. So there's really a spectrum of symptoms, but mainly the symptoms are systemic like this. And then they present sometimes with palpable lymph node, which is one of the presenting signs of the disease, that they have lymph node enlargement. They go to their doctors, and quite often, for sometimes they have not been treated for diagnosed with the disease. They are being treated because you're working too hard, you are not sleeping well, this and that. Eventually, if the lymph node is observed, that's the first sign that leads to patients to be evaluated. Sometimes anemia is one of the laboratory finding, and that leads to evaluation. But with whatever symptoms, the presenting other signs includes enlargement of lymph node, which could be just in one of the areas, like in the neck or under the arm or in the leg, or sometimes in the abdomen and chest, which can only be found by doing CT scans or some other testing. And then when we look at other possibilities, occasionally patients have skin.
Well, finally, the discussion of management. Surgical resection is the treatment of choice for unicentric Castleman's disease. For patients with surgically unresectable localized disease, partial resection followed by radiation therapy or radiation alone can be considered. Thank you very much. I hope you enjoyed this exposition.